I'm Dr. Roeder, board certified plastic surgeon.
And I'm Andrea Sparr, board certified physician assistant working in dermatology.
And we are the Rejuvaness Podcast. And today we're going to follow up on another episode that we started on teenage acne. And we're going to basically go down the age groups and talk about what it's like to have acne as an adult. And this is, again, the Andy show because she is the expert on medical treatment of acne.
Hitting in general, I think the next few decades work well as an adult stage, 20s, 30s, 40s. That's where you kind of hit most of your next set of hormones. I tell all my female teenage patients, I was like, our hormones suck because they do this our entire life. It ebbs and flows. So I may be able to get you clear in your teens. You come off medicine for a few years, then you hit that 20s, and you may have a completely different type of acne.
Right. I think we all know that our body changes, our hormone changes in response to so many things, yes. Environmental wise, and just normal body functions that will settle over time. And then as women, we become mothers. Yeah, and then we go through perimenopause. Mm-hmm. And men go through menopause too, by the way.
Right. They definitely do.
They do. Might be a little later than the women do. And there are other things like using external topical things that can sometimes change your skin milieu, as well as medications that we can take with life that can change. So I guess we will move from the teenage years maybe into our 20s.
Correct. So in our 20s, you're still going to deal with some hormonal acne that could be left over from your teenage years, but you still have that menstrual period type of acne that you can get only that 1 week out of the month when you have your period. You can have acne that's associated with more things like PCOS, acne that's associated with pregnancy. So there's definitely different things that we kind of try and tackle. But again, if it's more pregnancy related, there's limited products that I'm going to write for you. Yeah. That we kind of just try and push through those 9 months. And then after breastfeeding, we can revisit it. But in general, I think that's kind of the next stage of life of when we start treating acne.
I'm going to stop a little bit and talk about PCOS, which is polycystic ovarian syndrome in particular, because I think it's somewhat underdiagnosed.
It really is.
And it affects women in so many different ways. And acne can be a sign of it. So it's something that we need to be in tune as dermatologists, that maybe it's not just acne, but it is
an underlying
issue or presentation of something that's important for women because it can affect fertility. It also is related to hirsutism. So you can talk about what that is in the non-medical words. But let's talk a little bit about that syndrome, because I think their treatment for it's a little bit different.
It is.
It would be just in the dermatology realm.
It would be more than just a topical too, for the most part. So in general, PCOS can have many, many things that go along with it. The hirsutism, which is unwanted hair. You see people that come in with more hair on their chin or mustache area than they would like. And that's definitely one of the questions I ask when I feel like that patient may have PCOS and they've never been diagnosed. Mm-hmm. People struggle losing weight. People struggle with acne. People struggle with many things with PCOS, and then if they're underdiagnosed, they don't know. Mm-hmm.
And especially infertility too.
Yeah, infertility, having irregular periods, missed periods, long periods, short periods. It's an all-in-one category.
And I had an ovarian cyst that ruptured when I was a teenager.
Oh, goodness.
Yeah, and I did have thicker black hair, like that happy trail. Yeah. And I used to have this one beard right here, I swear to God. To pluck it all the time. Right. It was like my goat beard, my sister said, because you know how sisters are. They had to take care of you. But I did have a cyst rupture, and it can definitely be scary thing, especially if you're in your late teens or early 20s, to be in the hospital. And I mean, I had peritonitis. It was very different pain. If you've ever had anything like that, of having blood in your belly, it's not fun. And birth control pill actually helped me regulate that. And it made everything else better. It did make my acne better. It made my hairs lighter and basically make them go away. So I guess that's why I wanted to bring it up, because it is something that I had experienced as a teenager, and nobody ever told me those letters. I didn't really learn about PCOS or put together what had maybe gone on with me until I went to medical school.
Correct. And like I said, there's a lot of underdiagnosed things out there on the market, and it just takes one person asking a question to make you think, wow, is that something that I could have? And then it takes a little bit extra digging to make sure that's exactly what's going on.
That's right. And we talk about pregnancy.
Yes. Pregnancy brings out all the things in you that you don't want half the time. People come in and they're like, I did not have these 47 moles or skin tags until I was pregnant.
Right.
You can have pregnancy acne just due to the fluctuation of hormones. It usually stabilizes by second trimester because things tend to stabilize at that point. But there's very limited topical medications that I'm going to write for acne for a pregnant person. But topical antibiotics are good. Clindamycin is a good one that we can write. They can use some of the benzoyl peroxide washes over the counter. You just don't want to use something that could potentially absorb systemically.
And, I think we need to be kind to ourselves when we're pregnant. I mean, our body's going through so much.
Yes,
and a little bit of acne is going to be okay. It's better than taking any of risks. So if you do have severe acne or a version of it that is maybe intolerable to you during this period of time, then definitely see someone who is a dermatologist, a specialist. Right? To make sure that it is safe for you and the baby.
Yeah, because sometimes people still go buy stuff offline and they think it's just because it's over the counter, it's safe, especially safe to use during pregnancy. And that's not always the case.
Right. What about in our 30s? Do you have a lot of patients in their 30s that have active acne?
I am one of them. I still get little acne bumps. I made a post last week about, even your dermatologist still gets acne. You will get an acne bump here or there. A lot of us, this can still be due to stress, diet, hormone related, because hormones are still changing. Like I said, it ebbs and flows for women, so our hormones suck. That's what comes back to get us all. But in general, I think that a lot of it's just products that we use. We want those anti-aging products. We want the 47-step routine that TikTok says is going to make everything better.
47?
I'm telling you, these TikTok will be like, use 87 serums, 3 washes, some beef tallow, and you'll be 20 years again. That's not how it works.
Okay, I'm going to prove my ignorance here because I don't even know what beef tallow is, but so I know it's not part of my regimen. But if I had 47 things I had to think about doing, I would do none.
Right.
Yeah.
It's less is more for a lot of people. And I tell people my routine's 6 products, if that. And that is including my moisturizer and my sunscreen. So again, it doesn't take a lot to get your skin under control. I think a lot of people don't understand that their skin is different from their peers' skin, because what works for me does not work for you. It is a trial and error, especially when they come in to see me. I say, this may be your one medicine that you need. It may not.
Well, and if something is good for everybody and it's some hidden secret,
right?
Okay, I was going to say this to everybody. If somebody's trying to sell you something that nobody else knows, they only have, right? And somehow it cures everything, it cures nothing.
Correct.
Okay, they're playing on the placebo effect. So you're absolutely right. Things have to be personally tailored to you, to your skin, to your environment. And you mentioned diet, and we all know that is, to me, kind of like a bad word, right? Every time we say diet, people thinking about starving themselves or changing.
Yeah, I know.
But I think we should talk about nutrition, because what we put inside our bodies definitely reflects on the outside. So if you have a higher level of foods that are processed and fatty in nature, that's going to reflect in your skin. It's going to reflect in your guts and your subcutaneous tissues.
And I'll tell you honestly, one of my biggest pet peeves is when parents come in and are like, tell them it's all the stuff they're eating and drinking and they need to be vegan. And I'm like, no, I'm not telling your
you don't need to be that
child
extreme.
No, and not all acne is associated with your diet, not the food that you eat. Some people say dairy and cheese can play a role in it. Yes, I tell everybody 5 things that start with a C: chips, cookie, cake, cola, carbs. Cut back on it a little bit. You don't necessarily have to cut the things out in life that you like, but that may make a little difference with your acne. But there's also unknown things that people don't pay attention to that is contributing to their acne. Eggs, energy drinks, even patients that smoke marijuana. And I'm in there, I'm like, even people that smoke can cause a problem.
Yes.
That can actually mess with the androgens, make you more hungry, make you eat more sweets, and that can actually cause acne breakouts to occur. But again, I tell people not everything is associated with diet, but it can play a role in it.
Yeah, for sure. Perimenopausal women. I mean, here's another big
hurdle we got to get through in life.
Get through.
In general, I think as you age, your skin dries out. We talked about my other metaphor, I'm a big person about talking about metaphors, is we're like a fresh slice of bread when you're born, okay? As that bread dries out, because it's going to dry out in 2 or 3 weeks sitting on that counter, that's the way your skin does. And again, you still need to add that extra outside additive because you're not getting everything from the inside. So again, increasing your water intake is not all going to your skin. Your internal organs still need it too.
Yes.
But you start losing that barrier and things are getting out, including water, but irritants and stuff are starting to get in. So even older people with acne, they sometimes are misdiagnosed with like rosacea and stuff because their bumps are a lot smaller and a lot drier, and they're not understanding why their skin's so dry and red, but it can still be acne around perimenopause and menopause age.
Because you get that flushing too, right? So many things that contribute to that. And when we talk about hormonal acne, at puberty, at perimenopausal age related to pregnancies, it's all just a change and shift in the balance of testosterone and estrogen, progesterone in the case of pregnancy in your body. So there's different ways that just happens even monthly.
Correct.
And that can be exacerbated during these periods of time. But it's not necessarily that you can always just rely on one catchword for it.
Correct.
Because we might think that this is totally hormonal. And then people start thinking that it's related to gender specific or to specific times in life. But it can be hormonal without having to be related to these different exacerbated like taglines. You know, it's just every day our bodies change.
It does.
And we get tolerant to things.
And we've got to be kind to our body.
And we have to be kind to it. But we just definitely can use some catchphrases here, and I don't want somebody to get a soundbite and be like, well, you know, it's a woman thing.
Right.
Because men go through hormonal changes too.
They definitely do. And I tell some of my patients that I end up putting on Accutane that some people have to do a second round at some point in their life, and a lot of that's my men. My older men will do a second round if they have like chronic folliculitis, more acne bumps, and where they start sweating more. I mean, they go through that menopause too.
Right. And just having facial hair, right? A lot of cysts and things like that are caused from clogged pores and normally occurring facial structures.
And you will be shocked the amount of men that I say, are you cleaning your electric razor? And they're like, you have to clean an electric razor? Yes, you have to clean the electric razor. You have bacteria that lives on that beard hair, and it's just getting rubbed around, and they don't even understand that it actually comes apart for you to clean.
Yeah, I kind of love the fact that now there's like all this beard shampoos and conditioners.
And brushes and combs.
Brushes. It's kind of nice, man. You got to take care of yourself too, you know? Yeah, it's definitely a nice thing to do. And it might prevent some of these folliculitis that we see.
Yeah, so it's called pseudofolliculitis barbae. So fancy term.
I love fancy terms.
In general, I think just for men too, they still end up with some topical acne treatments later in life, just like women do.
Do you have a lot of men that come to you under their own volition, or are they coming because their wives tell them to?
It's a mixture. It's both and both. But usually the ones that their wife sends in, the wife circled everything that they don't like on them because they know they won't tell me.
I think it's changing a little bit.
Right.
I'm loving the trends where we have men be more self-aware of their appearance. I think a lot of times they had that in them, but it was just not accepted in society that they would actually show up to take care of their skin, to do things about their acne. They were maybe like embarrassed to address it. And I love when I have male patients. They're kind of like straightforward in my, like, just like my personality. I can tell them straight up.
Right.
You know, this is what we can expect. This is what we're going to do. And they're very like, okay, doc, like, I'm going to do this. I think they tend to follow things really well.
Right. And I think if you can get them in a consistency and routine, they actually love it. Even just some of my patients that come in with like chronic dry skin, they're like, I've been itching for 20 years. I put them on Cetaphil in a jar because I explained to them the difference between a cream versus a lotion. They come back and they're like, I bought 3 jars of that. I went from snake skin overnight to baby's bottom. And I'm like, yeah, it's just one little thing can make all the difference. Yeah.
And I'm so happy it's way more acceptable now, and that men are doing it for themselves. I don't know. I think that my boys are slowly kind of learning, maybe because I'm in this field too. But they're learning to find the things that they like. And my older boy is telling my younger one who's going through puberty, like, hey, you know, like, you should wash your face. Like, I love it. The message is getting out to them as well. Anyway.
Backside of that, I also meant to say earlier, washing your pillowcase, especially for boys because they sweat a lot at night, makes the biggest difference. That sometimes that just clears their acne up in general because all that sweat and that bacteria grows. And so any of my teenagers, again, I know we're on a completely different episode, but I meant to say this earlier, just washing the pillowcase once a week can make a difference.
Do you ever recommend silk pillowcases to your patients?
Not necessarily. Like I said, as long as it's clean, sometimes the silk pillowcases can make a difference. You see some beauty hacks with like how your hair is going to do well, your skin, the wrinkles, the silk helps. But I think it's all about the products that you use, not necessarily what you're sleeping on.
Yeah. I mean, I've thought about just buying silk pillowcases to find out if it makes a difference for me, but I sleep on the back of my head. I always have. I've never been really a true side sleeper, but I can tell what side of the bed you sleep usually when they're coming to me for aesthetic stuff.
The way their face is. And again, that's where you see some of that asymmetry as you age too, because it's just that chronic pressure on that one side of the face.
Yeah. Going back to the decades, right? Because we're talking about adults and not just active acne, but we touched a little bit of this on the other episode. We talked about teenagers, is that this is the time in life people are coming with the consequences of their acne and talking about their skin texture and their scarring and what we can do for that. What kind of devices do you like?
So I like the red lights. You know, there's a hit or miss on which one you're buying. If you're buying a $20 one, it's probably not going to work. I tell people you really still don't have to break the bank in some of these properties. I've tried the stick red light devices. I've got a face red light device. I think that definitely helps with texture and tone. Some of the blue lights are more for acne, so you'll see some of those.
Those are antibacterial for sure. So I had a blue and a red light device, I think before they became popular. And my teenager lost one of the blue light ones, so I don't know where it is. So, but I think it was like 6 years ago that I bought one, a medical grade at a conference, and it kind of just been sitting there. And then all of a sudden it's so popular.
Even the full body ones are popular now. You see people sitting every morning with sunglasses on in front of this big red light box.
Yes, and I was asked the question the other day, is a green light better than a red light, or is a red light better than a green light? And I was like, wow, like these things are so popularized now. It's totally blowing up. And I should just bring that. I have one box in my house that I should just bring to the office and just start red lighting people. I don't know why. It's very easy to do.
It is very easy.
Or instruct people after a facelift, you know, let's do some other things to maintain like your results, right? So some of these are maintenance products. So what are your go-to maintenance products in acne? Because we're talking about acne.
So in general, my go-to maintenance is definitely going to be the red light. Okay, I like that. I have a couple different products. I like my gua sha that actually can help push lymphatic fluid out. It'll open your pores a little bit more, so your products can actually get in a little bit better. Another thing is I am a firm believer in using your hands to wash your face. I do not like anything that's going to tear your skin or cause microcuts, especially things that have like exfoliating beads. That's why I don't really promote those clean cloths that people are getting. As long as you're cleaning your hands before you wash, you don't necessarily need a clean cloth. There's some actual Norwick's makeup cloths that have silver in them, and the silver keeps the bacteria away, so you can actually wipe your face down with that.
I don't know. Maybe all my Latin folks are gonna be mad at me for generalizing this, but like I grew up in Brazil, and I didn't know what a washcloth was until I came to the United States. Like we've always used our hands and soap, maybe a loofah. You know, we definitly have loofahs.
And that's the question I get to, is how often to change out your loofah. I mean,
change out your loofah or your washcloth. If it just sits there, in moisture,
just feeds the bacteria.
Yeah, it just feeds that bacteria. So, and I prefer showers to baths, and I prefer like just kind of letting the water run down my face, and splashing every now and then. I am terrible though at washing my face at night.
Right. And I tell people another thing is, if you wash your face in the shower, it just saves you one step from getting out and saying, oh, I have to go to the sink now and re-wash my face and get my hands wet and have it run down my arms. Just wash it in the shower. Save a step. The other thing I really like, and this is my cheat, this is what I do at night, is the gentle cleansing cloths by Cetaphil. Those work well as a wash. So even keeping them in your sports bag, your gym bag, your cheerleading bag as an adult, our backpacks, laptop bags, that when you feel like you really need a good wipe down. If you got 5 minutes, wipe it down. That's your night cleanse and you can go to bed.
Right.
Especially if you're not using any products.
And I love the light water-based ones. Again, less is more.
Less is more.
You don't need a lot of products in it.
And some people actually don't know, most of the Cetaphil products, they're actually made to be used without water. So you can put them on your face and wipe it off.
Oh, wow.
Yeah.
That's awesome.
Yeah.
I'm going to get myself some Cetaphil wipes. I need it. And I don't really wear makeup that much, mostly because I think I'm lazy to put it on, to take it off, mostly to take it off. And I maybe over shower. I shower twice a day. So I got to do it after the gym. I do it when I wake up, or before I go to bed. And that's generally when I do all my cleansing routines.
Skincare routine.
And clean skincare routine. Yeah. I carry it around with me. I've been slacking lately for you guys that know me well. I used to go to the gym every day at 5:30 in the morning and then come to the office, shower in the office. So I'm always carrying my skincare stuff with me so that wherever I am after the gym, I'm taking a shower, washing my face, and then I'll do my basic routine. And then when I get back home, after a day's work, especially doing what we do, you got to take off your scrubs. You got to freshen up.
You've been in a mask in the OR, sweat's running down your face. Like
exactly. And I might need that lymphatics drainage tip that you're using.
Oh, with the gua sha?
Yeah, with the gua sha, because I am noticing how I can't have a line after the OR from my OR hat now more than I ever did before. So I think I'm going to need some of that. That was a good tip there.
That makes me miss being in surgery so much.
We'll bring you in.
Okay.
Maybe we should do like a episode from the OR one day.
Yeah,
and you can go back to
my roots.
Your roots. That might be fun. And we also talked about Andy doing some facial treatments for me. I know she's a big advocate of PRP, and this is something that could be an adjunct to microneedling or on its own.
PRP promotes collagen growth in wherever you inject it. It is where we take your blood and we spin it down. We take the plasma out of it, and that plasma has all your growth factors in it. So it's becoming a big hit because it's something that's naturally that your body makes that we're re-injecting has very low risk, if no risk, for side effects because it's your own plasma. But it promotes collagen growth wherever you inject it.
And the reason I bring this up, because it might seem random that we're talking about like a quote unquote vampire facial. That's a trademark name, so we can't, you know, that's not what we do. Just, but it's platelet enriched plasma where all the growth factors are at. Is because it became very popular with microneedling. Right. And microneedling is something that we use for acne scars and using that as an adjunct. Yes. And now we're moved on to exosomes, so it doesn't require you to donate your own blood. We have something bottled. Yes. That's good to promote that. But as we get older and we might have sequelas from aging, from acne, there are a lot of treatments that don't have a lot of downtime. About 24 hours, that can really help you in so many different ways, not just in your acne, but in your overall skin health, and promote collagen and restore that for you. And it can be used as adjuncts. So it's good to know that we're going to start with a good, healthy routine. You should definitely seek a dermatologist if just the average thing that hasn't worked.
It's not working for you. Yeah. Don't spend any more money. Just come see me.
Yeah, just come see Andrea.
We'll get you the best bang for your buck. We'll fix your acne. We'll fix whatever's going on with your skin without you breaking the bank.
Yeah. And then you can do some fun facials too with the estheticians. And I'm sure Andy does some microneedling herself and definitely does PRP injections. And then we can just restore your whole natural beauty.
Yeah, and then we can do a deeper dive in what skincare products we like over the counter versus medical grade and go from there.
We're going to do a deep dive into that in one of our episodes, and we're going to get our little bags and bring our products out. So be on the lookout for that. And please comment below.
Yeah, like, share, tell all your friends and family.
All right, great. We'll see you for our next episode.